Hi, my name is Anthony Biziano. I am a student at Eastern Kentucky University in the Psychiatric Mental Health Nurse Practitioner program. I am currently enrolled in NSC 890, Synthesizing Evidence for Advanced Practice Nursing. The question or the problem that I had chosen was that patients are being identified as um, being depressed or having symptoms of depression in the primary care setting and are not receiving treatment following the identification of these treatments. Healthy People 2030 had uh, created as a national initiative an objective to increase the number of patients that are identified in the primary care setting um, that then received treatment in a 12-month period. And their goal was to increase that number from 64.8% to 69.5%, and that is in adults at 18 years of age and older. A primary focus was to increase efforts by primary care providers to identify patients with depression and then connect these patients with mental health care providers or mental health specialists, and that is a national initiative. The theoretical framework that I focused on was Nola Pender's health promotion model. Um, the key concept of the health promotion model is a recognition that the individual's unique relationship with their environment can have both positive and negative impacts based on on cognitive impressions created by environmental cues. And the one of the tenets of the health promotion model identified by Nola Pender is the integral part the health care professionals play in the environment of the patients. And um, the collaborative care models focuses on creating an additional resource in this environment, this healthcare environment, that would enhance the patient's ability to transition and receive care transition from primary care to specialty care, and it would facilitate that transition while also providing additional levels of education in terms of coping skills, and it would also transition some of the workload off of primary care providers and onto these specially trained, possibly nurses or case managers in the primary care setting, and that is through the collaborative care model and integration of mental health services in the primary care setting. The PICO question I asked was that in older adults, does using the collaborative care model compared to primary care provision with the usual care increase the number of patients identified with depression receiving treatments within a 12-month period? The three studies that I had chosen, the first level one evidence was Dom et al. This is a systematic review um, of evidence with the focus being on provision of collaborative care services in the primary care setting for older adults with a mean age of 60 years and older. There were two RCT studies, 1801 and 598 people, and that was the focal point. What is the impact of collaborative care services integrated in the primary care setting on depression symptom outcome? And there was statistical significance to indicate that the patients um, showed significant improvements in clinical outcomes for depression symptoms. Gilbody et al. Is a level two randomized clinical trial with the same focus on older adults in the primary care setting. What is the outcome of the use of collaborative care in the primary care setting versus usual care? And again, it was statistically significant that clinical outcomes were improved for patients that were provided uh, collaborative care approaches with the integration of mental health services at the primary care setting. Svenningson et al. Is a qualitative analysis study, and the focus there was on nursing perception after being trained as case managers with a 3-day mental health training course. And what did they feel? How did they perceive the quality of care provided to patients? And the primary benefit reported from the patients was an increased perception in quality of care. And a secondary benefit was the nurses themselves felt an improved or enhanced job satisfaction due to the enhanced training and ability to provide care in the mental health realm. The synthesis of this body of evidence is it could be synthesized into other research studies, as this is a nascent care model and it should be researched further as far as employing the collaborative care services in a variety of settings, not only the primary care setting, but also palliative care, hospice care, and medical units where patients are sick and identified as having depression. Can these services also benefit these patients with other comorbidities? And do they improve clinical outcomes of depression for these patients as well? A collaborative care intervention would be to provide additional training to certain, I would say, nurses, and then position these people as care managers in the primary care setting and determine if the outcomes for the patients are improved with this enhanced training and an additional resource for the patients. And again, the collaborative care, the setting that I would focus on is the primary care setting, as identification of depressed patients is most oftentimes in the primary care setting. And then it seems that there is a loss, people getting lost in the transition from primary care to specialty care, mental health. And so this could be a safety net for those patients, and also an additional resource for education, but also an additional resource for the providers as they can offload work. So I would say in closing, the benefits of the collaborative care model with integrative services for mental health in the primary care setting are promising, and they should be employed nationwide.